Hello. Okay.
Yeah, Annie is here actually.
Okay. Yeah. So we are not able to hear you. So Dr. Annie is here. Can you open your mic and come online? So Radhika, can you introduce yourself? When is the exams? Where are you preparing from?
Yes, I'm from Pakistan, preparing for my attempt.
Okay.
So you are doing communication today, right?
Okay, yes, yes.
So shall we start? Like, we need to wait or shall we start?
Yeah, Dr. Sabri, you can
Yes.
proceed. Yeah.
Yes, we can start.
Radhika, sorry, ready? Hello.
Yes.
Yes, okay. So we'll start your session. So you're doing communication today. So
Yes.
this is your leaflet outside the station. Okay. So we have a role player.
Net issue, yeah, net issue. Okay.
Are you ready? Shall we start?
Yes. Can I take 3 minutes for?
Yeah. So your 3 minutes starts now. So you can read the scenario. Is my slide visible?
Yes. This is visible.
Yeah. Yes. Please start your time. So meanwhile, we have a role player. Dr. Balaji sir will be a role player today. Yes, sir.
Is the time started?
Yeah. So you have 3 minutes outside.
Yes.
Okay.
Yes, we can start. Can we start?
So we have one more minute.
Zikash, if you are ready, you can start. I'm also ready.
Yes, yes, okay, we can start.
Yeah,
Okay.
yeah,
Okay.
you can start.
Uh, uh, Good morning. I am Dr. Vikas, working as a pediatric researcher here. Am I talking to Dr. Samul?
Samuel, yeah, doctor, I'm Dr. Samuel. Good morning.
Okay, okay. Good to see you, Dr. Samul. I am very pleasant that you are here to discuss today about your work at the ward.
Yeah, doctor, fine, doctor. I'm happy to talk to you. And
Okay.
we have met before. We have been working together in surgery department. So
Yes.
nice to talk to you again.
Yes. Okay, Dr. Samuel. Today we will discuss about the case that you have discharged some patient without involving the senior faculty. Do you know about this case before about this patient?
Which patient, doctor? Can you tell me? Like, is it that 4-year-old child?
Okay, okay. I will tell you that. Yes, yes, yes. This is the 4-year-old male child who you came to know. Remember that he came to us with the hematuria, and he was admitted there for the workup for the hematuria, but there was a report came of the ultrasound. Do you remember now the patient, Dr. Samal?
Yeah, yeah, doctor. Yeah, I remember. I remember that child. So,
Okay.
but first of all, tell me, Dr. Zikas, that who told you about these things? Like, did someone? Can you tell me the name? Is it the nurse or the my colleague? I want to know who complained about me.
Yes, Dr. Samuel, I understand your concern now. Dr. Samuel, basically, this is our unit protocol that we could not mention the name of the person or any paramedical staff who tell us about this issue because this is our protocol. And today I will discuss about the same case as you have discharged. Are you with me, Dr. Samuel?
Yeah, doctor. Yeah, but there is nothing much to any issues. Because I'm basically I was in surgery department before, so I'm very confident. Like abdomen is like bread and butter for me, and the child who presented with hematuria and the basic dictum in surgery is any abdominal symptoms do an ultrasound. So I did ultrasound and it was normal. So I discharged the child. So what's the big deal in this?
Yes, Dr. Samuel, it's very true that you are a keen doctor, and I appreciate that you have knowledge of surgery too, and I really appreciate Dr. Samuel. But there is some concern. If
Okay.
you can I tell you about Dr. Samuel? What's the issue here?
Yeah, doctor. Yeah, because I don't feel anything wrong about that case. That's why
Yes.
I'm very keen actually.
Okay, 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 Dr. Samuel. Now I will discuss you that do you know that when the child came with the hematuria, that is the blood in the urine. Do you know what's the main differentials we can suspect in this case? Like if we consider this child a 4-year-old boy, do you can you tell me?
Yeah, but important differential, whatever it's either it's a mass or any surgical emergency, the ultrasound should be able to pick it up. So ultrasound came normal. So I'm
Okay,
quite confident that
okay, Dr. Samuel.
it will improve.
Okay. Okay, Dr. Samuel, I can understand, but the problem here is that in the our medical field, like which we are dealing with the child and with the kids, with the very little small kidneys like a bean shape and the small ureters, there's not only always surgical issues. You know that whenever the disease occur, whenever the issue is
Okay.
present in the complain here, there's a medical issue and a surgical issue.
Okay.
If you consider that there is no surgical issue, then you have to rule out the medical issues. Are you with me, Dr. Simon?
Yeah, doctor. Yeah, now I do accept that. But
Okay, that's
I
good.
feel that we I used to give you the freedom when in surgery that you get the freedom to take your decisions. So the same
That,
thing I thought that I have the freedom, and that's how I learn when I get that free uh, thinking process. So I need some
Dr.
freedom.
Samal, yes, Dr. Samal, it's
6 minutes over, 3 more minutes.
okay, that's nice that you know, but in medical field, we have to rule out some differentials which are very important in this case. Like if we suspect this as a case of nephritic syndrome, then we must check the BP, blood pressure, which is very important here, and it is not picked up in the ultrasound. And like if we suspect of the case of the HSP, Hinoshon purpura, and some other vasculitis, there's the blood in the urine, but this not picked up always in the ultrasound. Are you with me, Dr. Samuel? That but I have just mentioned.
Yeah, doctor. So will it be a problem? Should we call them back to
Yes,
invest?
yes, yes, Dr. Samuel. That's why I am pointing out that whenever the case is admitted, and for the workup, like in this case, which is a very crucial if the patient come with the blood in the urine. So whenever the report come, don't take decision by yourself. Always involve the seniors. Like in this case, you have to involve the seniors. You have to check the other blood pressure, and we also check the other like urine complete, urine test, and some other tests which we mentioned.
Okay.
So that's
Well,
why this is very clear.
so will you tell to the consultant he might feel a bad impression on me? Will you be
No,
telling him?
no, no, Dr. Sumal. Look, Dr. Sumal, it is not the bad impression. It is the way of learning that if you involve the consultant, senior, and he will be happy that you are very curious, very keen to learn, and you know what are the other differentials, what are the other diagnoses I can make. Are you following my point?
Yeah, doctor. But will you tell this thing happened to the consultant? I'm a bit scared. Like,
Yes, Dr. Samol, it's very important because it's our protocol that if some case like this incident happened, we have to involve our seniors. Then I
okay,
have to consultant, Dr. Samol.
okay,
So, Dr. Samol, because I have to tell, it's better that if you go by yourself to the consultant and tell what's happened and admit your mistake, then it will be good, and consultant will know that you have taken the mistake, but now you feel guilty before I
Yeah,
tell.
doctor. If that's okay, then I will definitely talk to him. And
Uh,
regarding will the patient sue me if anything a problem? I'm like really worried.
Yes, Dr. Small, yes. When you talk to a consultant, ask the consultant to call back the patient and or some other way. So can consultant and a senior contact the patient and allow and call him to come back. So he can pave the path for further. Okay,
Oh,
Dr. Small.
okay, doctor. Okay.
And okay, Dr. Small, now you can you summarize what the importance of the blood in the urine and what's the importance of the differentials.
Yeah, doctor. I got a view like there are other causes other than surgical conditions, especially like hemocholin
Time
purpura,
up.
when we need to monitor, and we need to inform the higher team whenever in doubt. So that's an important learning point. I got it. Thank you.
Okay, yes, Dr. Samuel, that's very good. That you are you will a keen doctor, and I hope so that you will be prevent this incident in the later
Time up.
on.
Hello.
Thank you,
Okay,
doctor.
thank
Yes, doctor. So the scenario, like,
Dr. Sabri, we can stop the slideshow so that we can see each other.
Is it open now? Hello? Okay. So, Dr. Jakash, what was the scenario? What's your feedback? What your
Yeah,
performance today?
better you will tell. I am not sure what I have done. Better you will
Okay.
tell what I have done.
So this is one of the real scenarios came. So my opinion is like, see, the good thing is like your sentences were in short, so you were passing in between, asking whether you're going to follow me. So that thing is good, and you were appreciating the doctor. So that's a good way of establishing the rapport. And you asked in between pause and you asked whether are we able to understand the differentials. So those things are good. And you did give a good differential of maybe ascites or something else or global arthritis. So that can be a cause of hemoptyria. So that's a good medical cause, which can be told to a surgeon, basically who may not understand those things. So that's a good thing to tell. And you also told that we are all learning, so that's a good way to go forward. So that's a nice point you made that we are all learning anyway. So that's fine. Okay. So the other thing, where we can improve is, so you already know that you are all working in the same department. So does it require to ask like, are you so and so person? Because you both have already met, you are working in the same department. So what I felt is you can have a soft landing introduction rather than pitching like a routine thing. So routinely we tell like, I am so and so doctor working in the pediatric department. I may talk it to so and so person if it is a parent. Okay.
Okay.
So if it's a colleague, you can start it with like a soft landing, like say for example, hello, Dr. Samuel. How are you? How is the work today? We have met already. So how are things going in the department? So I'm Dr. So and so. How are things going? We have already met. So that will be a very soft landing. So you can establish the rapport like that. So how is the day today? So that you can ask. Okay. So that way, you not ask for a person name and confidentiality because you are already working here. That is so. This is one scenario where you do not, too much stress on that part, but you definitely have to mention the name, but stress on that much part. And no need to ask anybody to accompany here this person today. So this is a scenario where you not ask, would you like somebody to accompany with you? So you rightly did not ask that. So that's a good point. So before you proceed further, you can start. I think here you started saying that there is some concerns like about you are discharging the case here. I'm here to talk about that. Before that, I would suggest you to ask the perception of the other person. So, like you can ask, like, so doctor, do you know that why are we here today? So, what do you? We are here for some meeting. So, do you know what for it is? So you can understand whether some complaint has already gone against or like what that person's state is. That way you can ask. And also you can ask, you can always start with like, there are some concerns. I would like to know about your side of the story. So is there something like, say, for example, the other doctor may have some personal issues or he may have some family issues. He may be stressed out or he may have some difficulties. Say, for example, in this scenario, we had a thing like the ward is very busy. So he was not able to contact the other person. So he was busy, so he was taking in different decisions. So you can always start like, I would like to know your side of the story. So the other person will try to tell something. So there may be some hidden agenda, like say, for example, some of his family members may be ill, or like he is ill, or he is very busy, the ward is very busy. So he may tell something. Okay. So you always ask for the concerns and the other side of the story. And then you can go with the understanding. So understanding, like because this person has worked with surgery, you can tell like I had a good time during surgery. But here in medical, there can be scenarios like, say, for example, a urinary tract infection or maybe a glomerular can present hematuria. So do you agree? These can be other causes. Also, you can appreciate, as you rightly appreciated, because doing an USG will go to mass. So that thing you can appreciate, you have done that. So that's good. So next thing is after asking the concern and after establishing the understanding of medical problem, the third thing is you can go for the implications. So what is the implication for the patient? So we may be missing some serious problem like an, as you told, a global nephropathy or ATA. So that could be an implication for the patient. The patient may get sick. So that point you have to highlight and we have to emphasize to the other doctor because he has worked in surgery, he may not know the medical things. So the other opposite part is what is the implication for the doctor also. So you should also tell like because he's a colleague, right? So you can tell like this will also have a maybe a black mark, maybe it become a black mark for you, or it will have a difficulty in getting your completion, or it may like be a negative point for your residency. So this has implication for the doctor also. So that thing also you can highlight because he's a colleague. So you need to you like to him to finish the residency in a good way, right? So you can talk like that. So that will be more meaningful to the doctor. And finally, you can offer some solutions. So for because being a colleague, you can rather than asking him to tell to the consultant and asking the consultant to call the patient. So that may not be a good thing. Rather thing like you can tell like we can call the patient and ask the patient to come for follow up and we can do a re-evaluation. So that will be a very smooth way of taking rather than asking the consultant to call the patient. So we cannot ask the consultant to call the patient. So that cannot be a good thing. So either it will be the same person or it should be your colleague who can call the patient and tell that we need further investigations. Some investigation left out. So we need to do some further investigations. Can you come for a follow-up? That thing you can ask. So that was the solution. So in this scenario, the hidden agenda what we had is the ward was very busy, so he took independent decisions. So you can offer some personal help, like you can always call us. You have a number and you have other colleagues' number. You can give a handover to the next shift colleague. I understand that the pediatric ward is quite busy. So you can talk like that and you can offer a solution like, say for example, giving a number, you can call me, you have a number doctor, you can call me in case of an, you had doubt, you can call me anyways, or you can hand over to the next shift doctor. So that's where the solution, you can offer one of the solutions. And in case the other colleague is having a personal issues, you can may slightly offer a solution for the personal problem also. Say for example, he is ill, you can tell like maybe doctor, you can take a leave and take care of your health and come back. So that is one way of offering a personal being a colleague. So that is expected. And the fifth point is you have to finally agree for a follow. So I can tell like we have had this meeting, so we'll be reviewing your performance, doctor, and we'll see how it goes out. I'm sure that you are a good learner and you will be taking care of all these issues. So that will be a thing you can end. So then you can summarize and being a colleague, you can edit as an informal because you have already worked under him. So you can ask like maybe a very casual way, how would we discuss about this more during our evening coffee? That you can ask. So that will be a more casual way of dealing with the colleague. So these are my feedback. So initially, you should ask about the concerns of the opposite person whether he has any issues working in the department and understanding. You did check the understanding. And you have to tell the implications for the patient and for the doctor because doctor is your colleague, so you have to take care of the colleague also. So what does the implications carry for the doctor for his performance in the department? So that thing also you have to highlight to the doctor. And you can offer one or two solutions, both for the patient side as well as for the person's if he has any personal issues, and finally agree for the follow. So this way it would be a complete scenario. So like talking to a difficult colleague is one scenario where we may not know how the colleague will talk. So we should be like we should have a framework. So where we can go further. So this is my feedback.
Okay. So
What is that? You have that?
Yeah, Dr. Zikash, the main crux, he caught it. So he did it like the implication part, I think he didn't have any issue. He tried to say that why he should have informed the higher authority. What is the implication of missing the diagnosis? I think that part he did well. One part which I felt like Dr. Zikash, you jumped straight away to the initial intro part. We need not introduce, but we can just say, "Hi, how are you doing?" That rapport part, you need to build a rapport. Uh, how things are going because there is a stem there. He has moved from surgery to pediatrics. So how is the transition part going on? So that part rapport you can do. Then a bit I felt you were a bit judgmental. Straight away you said you missed. So there, that is you can ask what is his side of stand. So what do you want to say? So that part you can talk. And always there might be a hidden agenda. So the hidden agenda is there something bothering you? Is everything well at home? So there might be something that is bothering him, and that might be the reason for his coming late or not performing well. So try to address that hidden agenda if anything is there. So, and since it's a colleague, you can as Dr. Sabri said, we can always say we can talk over a cup of coffee about this in detail. So that part we can always definitely add. And one thing, whether you will inform the consultant, I think here some harm might have happened, and your consultant has to be updated. So we have to say, I have to update to the consultant, or the way you said was also good. It's better you update to the consultant because he has to support you in case the parents come and make an issue. So that part is there. Otherwise, overall, it's good. The initial part alone, you have to do well. From audience, anybody wants to add up? I think.
Any feedback from his side?
Okay. Actually, Ikra wanted to do it again, but maybe we have two more stations. We'll see. Or Dr. Ikra, do you want to suggest any extra points to this scenario?
I think you covered almost all the points that were in my mind. Like for introduction, as Samuel was transitioning from surgery, so we can ask, "Hi Samuel, how are you doing? Are you having a good time here? Or how is this specialty treating you? Are you adjusting well?" Like these are the
Yeah,
things we can say. Or for
I think that's very
disclosing,
good.
yeah, for
That's very
disclosing
good.
staff name, he asked like, can you tell me which staff told you about my complaint? So how to negotiate, like we cannot uh, tell Dr. Samuel that certain staff has told or fellow colleague. So how we will tell Dr. Samuel
So
that?
in that scenario, the best way is it is not about who told. So it is about what the problem is and how we are going to learn and improve further. So that
Oh,
would be an according way of answering. It is not about who told or who is the person
okay,
who complained. It is about what the complaint is. So you can tell
okay,
like it's not somebody who has pointed particularly, but it is about like how we are going to learn and improve further. So it's about the way how we are going to be in the department, how we are going to follow the protocols. So that could be a smooth way of handling.
okay. And about Dr. Zikash, I think did it very well, but he was focusing on this one example only. There was the scenario was multiple issues, like he's not been following previously also, but this issue was highlighted. So he can say is that there has been some issues regarding multiple patients, but this patient has got our attention that you recently discharged, like that. We don't have to give like he will be having hypertension. We can say like this patient that you discharge can have some complications in the future, and the parents might not take it well. So they might be back with some problems or complication, like that. Also, I want to ask that if some example is given, do we have to focus on that example also? Like we will keep our scenario for that example or the overall issues?
You can start with the overall issue. Like you can start like we have few concerns about your working style in this department. That is the way you can start. So then the rotate relax, may know what is the problem. No, I'm doing fine. So that's how he will respond. So then you can go, for example, we had an issue like this. So this is one of the issue like that. You can slowly take it over. So the time
Okay.
is only like 9 minutes. So you will not have much to discuss about multiple scenarios here. Usually there will be one regional. So one hidden thing will be there. So you are able to unlock that thing. So here the scenario is maybe he is shifted from surgery to pediatrics and the ward is very busy, so he is not able to, he thinks he is right. So you
Okay.
could just take over that point and unlock it and emphasizing that there are few medical reasons. And if you are busy, you can call us for help. You can hand over to the next shift doctor. So that will be enough rather than like focusing on too many causes. Maybe on 2 or 3 causes like pulmonary apparatus or mastitis or probably is UTI. Urinary tract infection is a common thing. So that thing you can tell.
Okay. And how to end this conversation? Like, how we will close the conversation with Samuel?
Always give solutions, as I told, like we give some solutions from the professional aspect. As I told, try to involve the consultant or involve the senior person in the department before discharging. So that is the main issue, right? So emphasis on that. And in case the maybe in a different scenario, the doctor tells that I'm sick, doctor, my parents are sick, or I have problem at home. Like that, if you tell something, you can try to offer some solutions, or you can at least like maybe you can take a break, doctor, and you can come back in a more better way. That would be a good thing you can do. Like that, you can offer a solution, person solution also. The
Okay.
final thing is you just ask, is it okay, doctor? Are you agreeing that these things are okay? Maybe improve on this. Can we have a follow? Like that, you can ask always. There is agreeing for a follow. So we will re-evaluate your performance. So again, so is it okay? Like be able to.
Okay. Do we have to ask? Do we have to ask him? Can you summarize like we ask from patients or no?
Here, I don't think we will ask the other person to summarize. If you have summarize, you have time, like you can summarize. So at the end of 6 minutes, you will have not. So after 3 minutes, like if you have time, you can have a short summary. Like so, we had this meeting because we had some issues, and we have discussed what the problem is, and you have agreed for a follow. That's very nice of you. So thank you for being there, and we will discuss more about this during our evening coffee. So that would be a nice way of ending it.
Okay. Thank you.
Need not summarize the points.
Okay. Thank you. Thank you so much.
Okay, Sabri, I think Annie is.
Yeah,
ready.
I'm ready. Yeah.
Okay, so your audio is good. Thank you.
Start with the first scenario.
Okay. So we
I'm
go to the
Annie.
clinic.
I'm currently working in UK, but I'm IMG as all of you guys. Yeah.
So when is the exam start?
I applied, but haven't yet received confirmation for June. Application period is not closed yet, so